find this rewarding because just to see a young person get that job or get that interview who maybe didn't have many chances before, and just to see them get to that next level is a reward in itself.
Berkshire County has so many assets going in our favor, and yet we've watched this major transition in recent decades from a strong manufacturing economy and that ability to provide for a lot of folks, and we shift to lower paying jobs that make it really hard for folks to just make ends meet. Median household income is below the state, our education attainment is below the state, our health outcomes are lower. And so when we try to address all of that, it clearly takes a team approach. We need to lock elbows. It's not going to be a silver bullet program that will be the answer, because we're talking about everything from child development to transportation and education and helping folks who are working and yet still need assistance.
We're a region in transition here in the county. And the transition has some good energy behind it in terms of the economy and folks trying to develop better tourism opportunities and the like. But we have a lot of folks who are left behind.
What I see is that people come to us for job training, for the soft skills, concrete skills. The resume and the interviewing is that quite often they have no confidence because they've been so beaten down by what they perceive as lack of opportunity in the Berkshires.
Stable housing is foundational to addressing a wide range of other issues, whether they be educational attainment, substance use issues, domestic violence.
We have a lot of people in the area that need services, and we don't have a lot of social service agencies.
Greylock's vision is to enable our community to thrive. And we've realized to have a thriving community that we need to be addressing the needs of all the community.
The Berkshires is kind of a unique area. There are often stark differences in terms of what the community looks like. There are very wealthy elements of the community, and there are elements of the community that are day-to-day working paycheck to paycheck.
Berkshire County has a unique population of service industry workers. So that means people who have jobs that don't provide them with full-time insurance. And it also brings in a huge immigrant population.
What we see in terms of housing challenges in the community, it's really housing instability where people move multiple times over a year or struggle to pay their rent and are constantly challenged to remain in the place that they're living in.
We do see folks who are challenged by not just their low income status, but by their health circumstances, plagued by health problems, which if you don't then have health insurance, you don't go get treated, your situation gets worse.
Well, I mean, I think it's something that everyone should do, and it feels really good to get out and help someone besides yourself. And especially with this project, it's helping an entire community, and it gives people a sense of pride in their neighborhood and in their community.
We have 2 concrete skills programs at the moment, one which is a nationally certified custodial program and a nationally recognized retail training program. Both of these programs not only include the skills that you need in order to do the job, but they also teach you the soft skills, the dependability, the motivation, the importance of time management.
Berkshire Works, it's made up of 2 organizations. One is Berkshire Training and Employment Incorporated. The other half is a Department of Career Services, and together we make Berkshire Works a one-stop career center.
BCAC is the federally designated anti-poverty agency for Berkshire County, and that is our charge, is to eliminate poverty here at home. Nearly an impossible task for us to do alone, and that's why we rely on the collaborations we have within the community.
Greenagers addresses a number of other issues in our community, including food injustice. A lot of people don't have access to healthy food. The areas in and around Pittsfield, there are food deserts. We are giving people access to that good food and empowering them to grow what they can and want to eat.
We also will work with folks who may have issues where they have had difficulty paying their rent, and part of that may be actually working with BCAC, coming up with a rep payee program so that the landlord knows that there's a structure in place. We know that kind of housing instability and homelessness is a lot of times the tip of the iceberg.
It's really important for people to have a place that they can call home. We've found that by working with Berkshire Housing as an example, where they have people that are prepared now to be able to own a home rather than rent, so they can come to Habitat participate in one of our financial education programs, become Habitat qualified, and to have that stability.
We have successfully been able to mobilize a community of professionals to provide free care for people who need it. And by doing this, we are directly impacting not only the patients' lives, but also the community.
I feel like the connection with the community connector has been great, and the agencies have helped us address all these other social determinants that affect people's life in a very drastic way that also have an effect in people's health.
The Community Connector is a way for all of nonprofits to share information, to actually refer people in a warm and caring way so that they don't have to retell their story over and over again. And then depending on what their need is, we can reach out to our partner that we have monthly meetings with, and we know their programs, they know ours, and we can refer them to the correct place.
So let me just add a little bit more about the Community Connector and how it benefits the community as a whole. It just streamlines all of the services a person may need in the community from different social service and human service agencies. And we're able to see, who's referring to us. They're able to see what we're going to provide, and it's just a lot better than trying to email someone or call someone. It's pretty quick.
Is it allows us to screen our patients for needs that they have beyond basic medical care, dental care.
If you walk into any one of our participating partners, you will be able to get access to services for all 30 agencies.
Oftentimes when people come to Goodwill for services, they're not just in need of a job, they're in need of a home. And so we try to work with them and support them by referring them to agencies that can help them, like Berkshire Housing.
It's an elder client, it may be elder services. If it's a client that has a developmental disability, it may be DDS.
Community Action Council.
BCAC, the Breen Center.
Goodwill, we work with Literacy Network, we work with the Elizabeth Freeman Center.
Berkshire Regional Youth Employment Board.
With the Berkshire Immigrant Center.
UCP, Berkshire Center for Families and Children, Construct, the community health programs.
ServiceNet or the Breen Center or even DMH.
Williams College, Habitat.
We work with all different types of agencies that really address all different areas in which we feel will help the overall health of our patients.
We're fortunate to have agencies and organizations like BCAC working closely with one another to address the needs of people, whoever they are, whatever their challenges are as they walk in the door or make that phone call to get help.
It's always hard off the top of your head to list all the organizations, but I know, for example, we probably do about almost 40 outreach events annually, and those really involve organizations from the north end of the county to the south end of the county.
Our customers all sign a release so that we're able to share information amongst other agencies with their permission. So I think it's, sometimes people just forget to mention, oh yes, I'm receiving, SNAP from DTA, or I'm working with Mass Rehab because I have a disability. So it's just really helpful when we're all at the same table.
I can give an example of a young woman who came to us for a voucher for clothing, which we do provide, and she was living at one of the local homeless shelters. So we provided her with the clothing, and we enrolled her in one of our training programs, and then she ran into all kinds of issues because living in a shelter is not a real comfortable place to be all the time. So through our efforts, working with Construct, as well as the Lewiston House, we were able to help her find temporary housing, and then Lewiston House was able to place her into permanent housing.
Well, I like working for Habitat for Humanity because it's such an inclusive community. It's a lot of fun to be able to get out there with the volunteers and actually see a project from start to finish, and it's just very rewarding in itself.
We had a 79-year-old woman that was going to lose her house because we could not get her furnace fixed. I was able to get the community to rally together. We came up with a group, we got the furnace fixed, and what a good feeling that is at the end of the day.
Every day when I get up in the morning, I know that through the work that I'm doing at Greylock with my partners in the nonprofit arena, that we are making a difference in somebody else's life. We do this by being kind to one another, by lifting a person up one at a time, and by finding solutions to some of the bigger problems that we have here.
In my role here, I really get to be part of a community that's a unique community in the Berkshires, and really get to see change. And every day when I'm walking around town, out and about, and I see our patients and I see them smiling, or I see our volunteers, I feel super lucky that I get to be part of an organization like this.
I have the blessing of being able to meet people that have worked with us 5 years ago, and they come in and they say, wow, look at my life now. My son is going to college. My other son just got married. And we're still in the community, and we get to see them thriving and get to really know that the work I do every day really does make a difference.
The work we do here gets to the core of who I am as a person. To be able to see the staff here at BCAC be able to make the kind of changes they make in people's lives is so rewarding, and it fills me with purpose and satisfaction.